My role with the Department of Health and Senior Services in Missouri is to help the department with the economic evaluation of its programs, to assess the cost, identify the benefits, and basically to determine if the juice is worth the squeeze. Public health infrastructure grant has allowed us in Missouri to seriously perform rigorous economic evaluation of many of our programs, which was missing previously, and now we can do that, and now we can identify for our stakeholders not only the cost but also the relative effectiveness of what we're doing, and showing that what we're doing makes sense. Not only does it make sense, it is effective, it saves lives and saves money too. We've identified premature death as being a real epidemic in the United States. Americans die prematurely at a rate double of our European neighbors. Missouri, actually, among the 50 states in the District of Columbia, is ranked 39th in premature death. And for African Americans, we're actually 47. So we've written an article basically highlighting this and showing that state investment in public health has a positive effect on reducing premature death among all groups, but especially for African Americans. So in other words, for every dollar spent by state government in public health, it reduces premature death among African American people by 60 years, whereas for whites, it's only 25. And we think it's an important finding. We hope to get it published very soon. It's in process right now. We have some interesting projects. We have one on the cost effectiveness of GLP-1. That is with our colleagues at MoHealthNet. That's our Medicaid program. We also have another project which is going to be a bit longer, but it is going to be looking at that premature death data and looking at the economic cost to Missouri. So what we're trying to do is we're not only trying to identify cost-effective programs, we're also identifying the cost of our failed action. And I think that's really important. Our HIV prevention services in the state, they reduce a number of infections yearly. And those infections reduce the cost to the health system, not only to the health system, but to the state of Missouri in the millions of dollars over time. The HIV prevention efforts in the state of Missouri, not only do they save lives, they also save hundreds of millions of dollars. Investment in public health and public health infrastructure gives a platform for public health departments to implement their activities, whether it be dealing with obesity, sexually transmitted infections, environmental health, health equity, all those issues. This public health infrastructure grant creates a platform to allow health departments to do that important work.